To start with, it was a very anxious moment when I realised that I'd be assisting on patients with special needs. Just from the simple fact that I'd heard different things they would be very difficult to deal with, that it would be a boring situation to be in because of the length of time needed with the patients.
You just have a patient, like any other patient, and you just work around the issues that they're having. Be intellectual disability, be physical disability, be whatever it is, you just work around it.
What you start feeling, the first challenge is, hey, I don't think I can do a perfect job in this now. I don't think I can handle it. And then you start feeling, hey, am I not good enough? Then you start feeling challenges within yourself and start answering yourself. But I think it's just a matter of growing out of it. It's a fear, anxiety, and an emotional state which we have to overcome if we want to help that population there.
We know that someone with intellectual disability has got 7 times more susceptibility to develop dental disease. Unless someone has got very tuned carer who knows exactly their behaviours, it might go unnoticed. The disease will get unnoticed until it's actually in its later stages. So they depend on us, the individual with special needs depend on us as a professionals to find out the disease rather than them complaining like you're an average person.
Hi, I'm Warren Schneider and I'm a specialist in special needs dentistry. I didn't start off as a specialist. I was very green in my general practice, and when I first took on special needs patients, it was through the mentorship and guidance of people that were surrounding me. They showed me some tricks and some skills on how to deal with special needs patients and the issues and challenges clinically. I wouldn't have got anywhere in my special needs career if it weren't for my mentors, and I learnt a lot from them. The overview of today's presentation is actually to give you some tips and ideas on how to treat patients with intellectual disability. It's just to demystify the whole process. We want to also look at the role of the carers and people who are advocating for their treatment.
Warren's just going to wash his hand and put some gloves on, okay?
To get a really successful visit really requires successful preparation. In that preparation, you've really got to ask a few questions. It's not just, can you come at 4:30 on Wednesday? You've got to say, are there any medical issues? Are you taking any medications? Are there any access issues to the surgery?
Good morning, Community Health Centre.
And who's going to advocate and sign off on the medical consent?
Oh, hi Pam, my name is Monika and I'm calling on behalf of Brian Campbell. He needs a dental appointment.
Is this his first visit to the centre clinic? Yes, it is.
First available would be with Dr. Adam Peters
On Tuesday week.
Brian has an acquired brain injury and can get quite anxious, and he prefers to see people or dentists that's female.
Is that possible?
Yes, Dr. Kerry Punchin could see Mr. Campbell on Wednesday week the 19th, if that suits.
Yes. What time would you prefer?
Mornings are preferable.
The earliest would be 11.
Nothing earlier?
Not at this stage, but I could call you if there's a cancellation.
That would be great, and if it's okay, I'll call an hour earlier just to make sure Dr. Punchin's on schedule.
Just to avoid any anxiety on Brian's behalf.
Good idea. You mentioned that Mr. Campbell has an acquired brain injury.
Is he able to consent to the treatment on his own behalf?
Yeah, he can consent for himself.
If Mr. Campbell is able to consent for himself,
We won't have to contact the next of kin. Thanks, Monika. We'll see you and Mr. Campbell on the 19th.
Okay, thanks Pam. Bye.
The other contact that I really need to be in touch before I can see my patient is actually the medical practitioner. The information could come in a written format on the application form, and usually I would need to look at that before I see my patient. And if there's anything that is unclear, it's I highly recommend that I would contact the medical practitioner, that be the general practitioner or a psychiatrist, a psychologist, a specialist of any sort, and get more information. And once all this valuable information are there, it's very important to put them into the documents in a very clear way. If I'm not here, another clinician picks up this information, they've got all the information there to arm them and they're ready to go through with that patient without having to ask the same questions again.
Start just having a look in the mouth, or just making them comfortable in the chair so that they give you a high five when they leave the chair. That can induce a bit of confidence in you as a clinician, and then comes a step 2, then comes a step 3. So nobody expects you to jump on step 5 to start off with. Just step 1 would be good enough. Just let the door open up first.
In this scenario, we'll be seeing Kerry, who will be treating Brian, who has a complex mix of mobility and communication issues. And by the way, the people that are playing the patients today are actors that have come in to do that role.
Here we go, Brian. Now we're just in the dental surgery that we're going to be seeing you in today.
If you've got a patient that's had a brain injury, sometimes that person is going to be a little bit more confused than they may have been otherwise. They may be a little bit slower to understand and take in what's being explained to them. So you've got to give the person time to process what you've told them and take it on board.
So Brian, what we're going to do, we're just going to move the chair around here a little bit further, and then we're going to see if we can get you across into the chair. So we'll have a look at your teeth and give them a good check and see what's happening with those gums you're having trouble with.
There'll often be a situation where a patient initially may be reluctant to sit in the dental chair.
Be really brave for us.
No.
No? Okay. Look, Brian, the reason that we pop you in the chair, it's really just so it's more comfortable for you.
And you're really
well,
just
as well
trying
as
to
for me as
demystify
well,
whatever
it
it is
means
that this
you'll have
person is
head
worried
support.
about,
Not looking too
so that they
small,
can see what it is,
You're
they can
rather
see what
worried.
it does, and it won't
don't
be
think
such a
you'd be
strange and
able to
unfamiliar
manage it?
thing next time.
What if we have a look at your mouth and just you can stay in your wheelchair, but we just have a look that way? Do you think that might be better? Can you manage that? Yeah. Look, we'll just take it slowly, and you'll be
You've
fine.
got to
okay?
give the patient some feeling of control over what's going on, so they may want to choose whether they're going to be seen in their wheelchair or whether they're happy to transfer into the dental chair. You would have an intention of gradually introducing things to the patient so that over time they would become more and more comfortable with what would normally happen in a dental situation. But initially the focus is more about making the patient feel comfortable and at ease, and to have an experience of success, that they've come to the dentist and there's been a successful
In
outcome.
your mouth, so I can get a good look, and we'll have a look at your teeth and gums. And
Some patients will just sit in the chair and open their mouth. Other patients need a lot of explanation as to what we're going to do and how we're going to do it. Strategies that help in that case is more about getting the patient to relax. If they're very tense, it might be getting someone to hold their hand or massage their shoulders. I sometimes ask patients to take some slow, deep breaths in and out just to help them relax a bit more.
Clean and tidy while we're having a look. Now, the next thing
One of the things I've learnt working in special needs is just to take things very slowly, step by step. I may not start with dental instruments. I may start looking in the patient's mouth just with my hands or with gloved hands. I may start with a toothbrush and just gradually introduce things.
Now just relax your lips and cheeks a bit. That's right, just relax.
Talk to the patient
Now, what I'm
about, well,
doing
what
here
we'd
is
like
just
to do next time. How do you feel if we do this, or how about if we try that? They go away and it's a positive experience. There is a little bit more trust. They are a bit more willing to try something that they may not have been keen to try in the first instance. It's just such a positive feeling, seeing them feel more confident and more comfortable and happy to come to the dentist and have regular care rather than just being seen once in a while. It's a fabulous job.
When you have a patient with special needs, it's a good idea to say, hey, you have to make sure that everything is safe for people in the clinic present, because you're the clinician and you have to make sure. You have to communicate very well with your assistants there, that what you are going ahead for and what is your intention, so that she can assist you in creating the environment.
Us clinicians could tend, to get too involved in what's happening in the mouth, but my dental assistant always is tuned to what's happening in the room. If she feels, the knuckles are getting a bit tense or white or whatever, she'll always, draw my attention to that.
A lot of the times it is the DA who is communicating with the carers about explaining paperwork to them, what it is that actually needs to be the next process in the treatment, and also just organising appointments. There's a lot of different factors having to that are involved bringing a patient with special needs into a clinic.
Treating people with intellectual disability is much the same way as you might treat somebody with a periodontal need or endodontics or need orthodontics. You just start with the really simple things and work to a higher level of skill. What you want to do is actually place yourself in the chair with the patient, have that empathy, see the treatment from their point of view. And that means you get an insight into their anxiety about the procedure. Improving their dental health and their oral health will have knock-on effects to their general health and their mental health. And at the end of the day, they have a legal right to access treatment as much as anyone else does. Some of the issues faced by patients include advocacy, consent, access. Financial burden is also a consideration. Who's going to actually pay for that treatment? What about the anxiety of the carers and the family members themselves? Anyone can be anxious when they go to the dentist.
Carers help you interpret those physical movements which might not mean anything to you, but might mean a lot of communication, has a lot of communication value. So it's good to have the carer around to explain you or help you making a decision what's going on there.
Without the carers, a lot of the times they either can't be brought into the area that you need them, and they don't understand what's actually going on. And it's also a comfort factor for them as well to have their carer with them, the dental team, and the carer and the facility that the patient is in all need to be on the one page with what's going on.
Be a family member or a paid carer, they know that person much better than me. So, I need to find from the carer, I always ask that question, what is it that they like? What is it that they don't like? And what can I do to make it easier? What do I need to avoid? I'll give you an example. A patient with autism, we do an interview over the phone before they come in, because that could be invaluable. If someone with autism, they're very fixed on their likes and dislikes. So if they don't like the color pink and they don't like females, don't make an appointment with a lady wearing a pink coat. May have a male clinician, with a blue coat or whatever. Make sure they know the subject of interest, so you can keep them occupied and they'll be happy.
In this scenario, we'll be seeing Deborah, who will be treating a patient, Nikki, who will be playing the part of somebody with Down syndrome.
I would say gaining their trust is a big issue.
I'm Deborah, I'm one of the dentists. Hi.
If they're comfortable with you initially, they tend to not do what you say, but they're more compliant with what you want them to do.
Have a little look at your teeth today.
No.
No?
No, that's right.
Oh, I've got a lovely fancy chair.
I know you got a chair, but I'm not interested.
It goes up and down and back and forward.
No, I got one.
So I like initially to get to know a patient with special needs.
Who's your favourite singer?
Britney Spears.
Britney Spears, oh I love her too.
They often have an interest that they are very passionate about.
Okay, mine is Oops, I Did It Again. Do you like that one?
Yes, I love that one.
And if you can get to that interest, then that's the first step to gaining their trust.
My chair?
Love to, let's go.
Excellent, let's go.
You have to take things slowly and think, how does the setting look to someone with special needs?
Do you want to have a try?
No, I don't want to.
You don't want to have a try?
No, I don't want to. I want to do it.
So you have to try and make things nice and happy, nice and friendly.
What about Chris? What do you think? Will we let Chris have a try?
Yes.
Try and see the world through their eyes, I guess.
Really easy.
Legs up.
Pop your legs up and then look at this.
There we go.
Goes back like you're lying on the beach. What do you think?
Yeah.
Do you think you can give it a try?
Yep.
Yeah.
I'll give it a shot.
Okay.
If they're with a regular carer who they trust, them kind of demonstrating how things are done can often be helpful. And if you keep it that way, that yes, this is exactly what's going to happen, then that will relax them,
so easy,
and you're not going to be freaking them out with something that you haven't already demonstrated to them is going to happen.
Yep, so what we're going to do now is have a look at your teeth. Alright? Can you open your mouth for me? Can you open up your mouth for me? Let me show you my mirror. This is my little mirror, so that I
Don't touch me!
So that I can count all your...
I said don't touch me!
Okay.
It's okay, Nikki.
What if we have Pearl holding your hand?
It's okay, Nikki.
Okay. So now I'm just going to count to 5. And that'll be you finished if you can open up your mouth.
There's always a way around any situation that happens.
Open up your mouth.
Patient goes away happy having had their examination, their oral hygiene improves, and they go from a patient with special needs to a regular patient.
Doing well, Nikki.
3.
I always walk away from work feeling very, very happy.
Brilliant, Nikki. You've got beautiful teeth.
Sometimes you've just got to take it a bit slower with them, walk them through step by step and just put them at ease. Another thing is our clinical attire, masks, safety glasses, gloves. Sometimes you do need to just dress down a little bit to remove the clinical side of it, the smell of the clinics as well, even down to the looks of the clinic. I guess you need to be a bit flexible when you're working with patients with special needs.
There's a whole lot of myths that surround people with intellectual disability. There's a whole spectrum. For instance, in autism, the mild patients are certainly within your capability and practice. The other thing is somebody who's in a wheelchair, somebody who's physically disabled, there's no assumption that they have any cognitive or intellectual deficit at all. Some other myths surround those of communication issues. If you have a communication issue, it doesn't necessarily mean that you have a cognitive impairment. You may actually be able to advocate and consent to your own treatment.
If the patient is cognitively able to consent for themselves, that would be the most preferable option, and that's where I'd start. If the person have got intellectual disability or unable for whatever reason to consent for themselves, the next option is to establish who is the medical power of attorney. Third step, if there's no medical power of attorney, there's no next of kin, will be the Office of Public Advocate. And we make a contact with them. There is specific forms called 42K. It's important to remember it's 42K, not M, because the M is the medical version. And the form, at the beginning, it might seem a bit tedious to fill it, but it is just making sure that you're acting in the best interest of the patient.
Hi, I'm Christine.
In this scenario, I'll be treating Scott, who will be playing a patient who has autism.
He's just getting really upset.
Okay.
Further we've got driven along.
It's Scott, isn't it?
Yeah.
Yeah, Scott. I'm Warren.
Okay. Scott?
Hey, Scott. Scott, I'm Warren. How are you? I'm the dentist. I'm going to have a look at your teeth. So we're going to go up into the clinic now. You'll be okay. Christine will be with you. All right?
So I'll come up with you, Scott,
Yeah.
and we'll get Warren to have a look and see how things are going and what he can do for that pain, all right?
Good one.
Great.
Excellent. Oh,
That's fantastic.
great.
Really
Over
good.
this way. So here we are.
So here's our chair if you'd like to come and take a seat.
Okay, Scott, you have to sit down and Warren can have a look and see how we're going.
Sorry. Okay. Scott, so tell me about what's going on in your mouth. You've got some pain in your tooth? You're showing me, is that left
Been
side?
touching his face for the last couple of days, but we're just not sure whether it's top or bottom, but it's been that same side.
On the left, is it? Do you think it's on the left, Scott? Okay. Is it sore on that side, on the left? Yep. Scott, do you reckon it's the top tooth or do you reckon it's the bottom one? Top, yeah? Yeah, top.
Not sure.
So what say we have a look-see? Amy and I put a mask on and some gloves and stuff. Christine's going to just step in here. I'm going to wash my hands with Amy.
Okay, Warren's just going to wash his hands and put a mask and gloves on, and then he's going to come and have a look and we'll see what we can do for you, okay? Now Amy just wants to fix you up now.
Okay, Scott, so I've just got this bib that we're going to pop on, okay, just to keep your jacket nice and clean. Is that okay? Beautiful. And we've also got some sunglasses here that we need you to put on, just so that way your eyes are protected from the big light we've got to use. Do you want to pop those on for us? Good man.
Okay, that's really good. Now, Warren will be back in just a couple of minutes, okay?
Okay, Scott, we're going to have a look at this tooth. The mirror's going to go. I think the person who has an intellectual disability, despite that disability, has lumps and bumps and toothaches just like everyone else. And if you've established that rapport, communication and cooperation, there's every reason that you should be able to do the clinical phase and the management for that patient and alleviate them of their pain and set up a clinical pathway that is going to ensure their oral and dental health and well-being in the future. They should have regular recalls and checkups and prevent disease in a regular program that you would for any other patient.
I don't have the right word exactly for it, but I think gratification, self-satisfaction, and you can use the word rewarding there. But I would say it's personally you grow a lot.
It might be challenging. It might be, needing more time or whatever, but the, rewards outweighs any of these challenges. And once you get involved, you'll get hooked. You will not be able to get out of the group of special needs because it's so rewarding.
You do become emotionally involved sometimes. It's very hard to shut off the emotional side of it. The empathy that you can develop with them, and definitely the bond that you get with them as well is the most rewarding thing you could ever do.
When I wake up in the morning and look forward to my day at work, I think about what are the challenges in treating people with special needs. It's no cakewalk, but really what you put in is what you get out, and that little effort pays back in spades. You've done something that's positive to a group that has certainly strong identified needs, and the benefits can go on and on for those patients over a longer period of time. If you'll find yourself in the right supportive environment with carers and staff and mentors on board, it's a great journey. And really, the rest is up to you.